Hi, my name is Isabel Trout, and welcome to my presentation on autism. Now we'll be moving on to the introduction portion of this project. My research question is, how does horticulture therapy help the behavior of autistic children? Why did I choose this topic? One of the reasons that I chose this topic is because of my cousin. He is currently 6 and has autism. So I took this opportunity to learn more about it and how horticulture therapy can affect someone that has it. My cousin has limited speech and doesn't really talk much. He also doesn't behave well in social situations. I want to take what I have learned from all this research we have done this semester to help me build a better relationship with him. Before we begin, what is autism? Autism is a disorder that is more common in males than females. Not everyone that has autism will have the same symptoms or even be on the same end of the spectrum. People that have autism can experience things like having a hard time talking to others. They may even behave differently than we do. Now we'll be moving on to the research results. After doing some research, I have discovered that there isn't much information out there about horticulture therapy and its effects on behavior in children with autism. However, studies that I did find did not include things such as control groups. Most of them were observational based, which means that almost all data collected from these studies were based on treatment groups. Studies that were looked into, however, did help with gaining information on the topic. In one of the studies on how point of view videos had an effect on autistic children, using a POV approach during vegetable gardening could be a desirable intervention for adolescents with ASD to teach them vocational skills in their daily environments, Kim, 2017. The results indicated that there was an improvement in on-task behavior because it helped them understand how to do the task. Another study done by Flick on sensory issues with children that have autism, this study showed us that just by having these children participate in activities such as planting can improve their social behavior. They had these children do a potting activity that introduced them to textures and smells and allowed them to work with others. By having them work in groups, it allows them to be comfortable being around people and help with social behavior. Which leads us to 2 studies on how just being in the garden can help. Children, when completing a task such as gardening, can be very helpful when looking into how they behave. These studies demonstrated how just by playing in the dirt or touching plants can help with their behavior. One of the cases showed how a client with autism that had a temperamental behavior due to sensory issues, Bonsai, the one that conducted the therapy, explained by having the client do HT-related activities and improve their behavior. This worked because it helped them get used to the feeling of different textures in the soil. This is one of the POV videos graphs that they displayed in their work. Here's just some pictures from one of the case studies. Now we'll be moving on to the conclusion section. How can we use horticulture therapy to help the behavior of children with autism? There are many ways that horticulture therapy can improve the behavior of these children, as stated previously. Overall, the most important thing about this research is that horticulture therapy can help anyone. However, I think more research needs to be done on the effects of horticulture therapy on children with autism. Here are my references displayed in these next 2 slides. Thank you for listening to me talk about horticulture therapy and how it can help children with autism.